Now you are looking into the lateral view of an embryo. Here what do you see? You can see that the bowing head of the embryo showing the frontonasal prominence of the prosencephalon, and here you can observe the nasal placard, and on the lateral aspect you observe the optic placard, and these are near the neck region, future neck region, the otic placard. Here you observe the pharyngeal arches, and in between the head or cephalic end of the embryo and the cardiac bulge, you see an opening or an area called as stomodium, the future oral cavity. Okay, after that we have to see another picture. Anteriorly, what do we see? We see the frontonasal eminence. These are the nasal placard, and we see this is the stomodium. During facial development, we observe that the frontonasal eminence, which is unpaired, and two maxillary prominences, which are paired, and the mandibular prominences, which are again paired. Then we see these first two processes are formed from the first pharyngeal arch. Then you see the second, third, fourth, and sixth, and this is the cardiac bulge. And you notice that only the first pharyngeal arch takes part predominantly in the formation of the face, including the frontonasal prominence. Okay, next see that these were initially nasal placards, then this ectodermal region that gets its shape just like a pit. How? Because the frontonasal eminence gave rise to two swellings, the medial nasal swelling and the lateral nasal swelling due to the underlying mesenchyme. Both sides you can see. So hence converting the nasal placard, which is ectodermal origin, into the nasal pits. Okay. Now what do you see? These were two maxillary processes, and finally these maxillary processes, they are approaching the medial nasal processes on both sides, and now just separated from the lateral nasal processes, and there is a groove in between the maxillary process and the lateral nasal process, and this is called as nasolacrimal groove, and finally it will become the nasolacrimal duct. And you can see that these on the lateral edges, these are the eyes, future eyes, and this nasolacrimal groove, what happens? Its ectodermal cells, they proliferate and they form a solid cord-like structure. Later on, apoptosis occur, and this cord-like structure is transformed into a hollow duct. Hence, the nasolacrimal duct is formed. Now, what do you see? Now, observe this picture. Here, these mesial nasal prominences on both sides, they are merging in the center, right? Okay. Now, we have to see what happens next. After the merging of these two, we have to observe this green central portion formed by the merging of medial nasal prominences. They are now forming the dorsum of the nose, the tip of the nose, and the philtrum, the area between the nose and the upper lip, right? And what the lateral nasal prominences are going to do, they just form the lateral sides or ala of the nose, right? And what these maxillary processes are doing, they are approaching medially to meet each other, and with that of the medial nasal prominence, which is merge one, and they are taking part in the formation of your cheeks and the upper lip. Okay, now this medial nasal prominence is, which is this area is stomodium, and this is merged medial nasal prominence, that is after forming the intermaxillary process, takes part in the formation of philtrum. And if we see anteriorly, we can saw the upper jaw with 4 incisive teeth are also being formed by them. And if we see another section, let me show you later on, that the initial primary palate, triangular portion of the hard palate will also be formed by the intermaxillary segment. Okay, now we see the formation of nose or nasal cavity. Again, see the front view of an embryo. Here you can see the forebrain. These were the nasal placards, and this is the stomodium and the respective maxillary processes, mandibular process that is fused and forming the lower lip and lower jaw. And these are the first structures to be formed. Okay, we are supposed to take a section at this level. So see here, that was the forebrain region, that is the intervening mesenchyme derived from the mesoderm. Then you see the ectodermal ridge here becomes thickened to form the nasal placard. Now concentrate on this picture. Again the same features, but what is happening due to the prominences formed. This is the initial prominence of the lateral nasal process, and this is the medial nasal process or prominence. They are formed and completed as a horseshoe shaped prominence. Let me show you. This is the horseshoe shaped prominence, right? Okay, so when they are produced, this placard is now converted into a deepened pit. That tip becomes invaginate and then forms the nasal sac, and we see this, though these two processes are approaching each other, and we observe anteriorly located nares or nostrils. Now concentrate. After that, another picture. Now we have taken a sagittal section in which you can see this is the nasal wall, this is the nasal cavity, this is the brain wall, and if you remember that I mentioned intermaxillary segment formed the primary palate or triangular portion, first palate of the hard palate region. So that is intervening, and just below this is the oral cavity, and it will continue as pharynx down, and this is the tongue. So after learning this anatomical structures, what we see that there lies or developed an oronasal membrane separating your nose from the oral cavity, and you see that the upper wall of the nose, their epithelium becomes specialized to form olfactory neurons, and you can see their axons are running upwards towards the skull to be passed through the cribriform plate of ethmoid, and they collectively form the olfactory bulb, and finally reach towards the brain to take all the sensory sense of smell information towards your brain tissue. Okay, now concentrate on that picture. What is happening, that we can see the deepened nasal cavity which is well established, and the oropharynx. This oropharynx membrane is it was disintegrate rather, and no more there. Here what do we see? We have seen this initial triangular palate, primary palate, and finally we have seen that this is the secondary palate, and it completes the hard palate. And above that we must be seeing a nasal septum that is being removed to show you the lateral wall, right? So another structure behind or below the hard palate is the soft palate, and we must know that the nasal septum, if it is there, the region up to this level, the nasal septum is present, and in front of this all, bone of the hard palate becomes ossified and becomes a hardy tissue, but where the nasal septum ends, the bone doesn't ossify and forms the soft palate. And here you can see that is the oral cavity, and this is the tongue region, and that is the pharynx. So this is how you will explain the formation of the face and the nasal cavity.